everyone. Good afternoon. I'm Dr. Rahul Tiwari, urologist and uro-oncologist working in Kailash Hospital. And today's discussion for Med Talk is BPH. So, what is BPH? Before going into its symptoms, its treatment, management, I would like to first know what is prostate. Prostate क्या होता है? इसे हिंदी में कहते हैं गदूद. So, what is its role in males? Then the symptoms of BPH, the incidence and prevalence of BPH, how to manage it, and what are the various modalities of treatment available. So first of all, prostate. Prostate is an accessory male sexual organ located deep inside the pelvis. The function of prostate when we are young is production of secretions which help in semen formation. So it's a male accessory sexual organ helping in vitality. The location of prostate. I have a specimen here to show where exactly it's located in male pelvis. It is a small walnut-shaped organ, as you can see, a small walnut-shaped organ located just below the bladder neck, and the urethra transverses through it. So this organ is roughly about 3 centimeters in size. It produces secretions which help in semen formation. So what happens is when this prostate enlarges, as you can see, when it enlarges, it compresses or impinges upon the urethra, leading to obstruction in urine. This is another specimen. We have the normal prostate here and an enlarged prostate here, causing compression of the urethra, leading to changes inside the bladder. So what exactly happens once this prostate is enlarged? So basically the symptoms of prostatism. They are grouped under a category called as lower urinary tract symptoms, which consists of both voiding symptoms as well as storage symptoms. The storage symptoms are frequency, urgency, and nocturia. And voiding symptoms are poor stream of urine, dribbling of urine, straining to void, or sense of incomplete evacuation, or taking time to start the voiding process. These are various symptoms of enlarged prostate. The symptoms are not directly related to enlarged prostate. It can be seen in various other conditions as well. So hence the name lower urinary tract symptoms. So what next happens if prostate is enlarged? First of all, the impact that it causes is the person, his life is bothered. He has to get up multiple times at night to void. His sleep is incomplete. On occasions, he may sustain fall while going to the washroom, and the incidence of prostate, any 50 to 60 years of males, the incidence is roughly around 50%, and in males above 80 years, the symptoms of prostatism is around 80%. So it is fairly extremely common in males, but not all enlarged prostate will produce symptoms. It is microscopic BPH sometimes which doesn't produce symptoms at all. So after the symptoms, next is what are the risk factors for enlarged prostate? There is no as such risk factor. It is a process of aging or senescence. Every male has to go through it, and it is an aging process. But sometimes, yes, obese people are more likely to have the symptoms because of enlarged prostate. Next is sometimes hypertension or sedentary lifestyle. This may contribute to an exaggerated symptoms of prostatism. How it affects your daily routine is the person is disturbed the entire night. He hasn't slept. His daily activity routines disturbed. During his office hours also, he has to go multiple times to the loo, so he couldn't concentrate on his work. So the symptoms of prostate are, once he visits a urologist, the symptoms of prostate, we perform through a questionnaire, we grade a person's symptom into mild, moderate or severe. There's a scoring given called IEF scorings, and because of that scoring, IPSS scoring, we get how much bothersome are these symptoms. So next up is what will happen if these symptoms are not controlled, or if prostate problems are going on without treatment. This can lead to recurrent urinary infections. This can cause stone formation. It can lead to diverticular formation. Because of enlarged prostate, one day your urine might stop, called retention of urine. It can be both acute retention as well as chronic retention of urine. Acute retention of urine is usually associated with severe pain and stoppage of urine leading to catheterization. Next up is chronic retention, which can cause changes in the function of the kidney as well. So it can lead to kidney failure if it is not treated at the earliest. Recurrent infections might add morbidity. Patient might be admitted in hospital with fever and chills. Stones leading to hematuria. So these are various complications which can happen if the BPH is not treated. Next up, how do we approach a case of enlarged prostate in our practice? We usually take the medical history first. Patient symptoms are scored, and next we ask his, we take us through questionnaires, we assess his symptoms. Then we perform a digital rectal examination. So DRE is performed in the OPD visit only. Patient has to put in lateral decubitus position, and using finger, we check the enlargement of prostate. It is grouped in grade 1, 2, 3. Based on that grouping, next up is we perform urinary tests. Few tests like simple urine routine and culture, few blood tests like CBC, RFT to know if any infection or kidney function. Important is to perform a test called serum total PSA. So what exactly is this PSA? PSA is a prostate marker. It is prostatic specific antigen. This PSA is released from prostate, so it can be high in patients with BPH, prostatitis, or malignancy, like CA prostate. So PSA helps us to know gives us the indirect evidence about the size of prostate and helps in management after treatment as well. So PSA is performed and few blood tests are performed, urine sample. Then the important test which we perform is uroflowmetry. It is again an office procedure, non-invasive procedure in which patient is asked to hold urine and void on an instrument called uroflowmetry. It gives us few ideas about the person's flow of urine, whether the flow is normal flow or it is an abnormal flow. A normal flow is usually a bell-shaped curve which comes on uroflowmetry, and it gives us the idea of the dynamic parameters like a maximum flow of urine, the average flow, the voiding time, and the graph. Based on that, we put the patient into grades. Next is we perform ultrasound, which gives us an idea about the residual volume or the volume of how urine patient is holding, and the size of prostate, whether it is 20 to 30 grams or 50 grams, so whatever is the size of prostate. These are the ideas we obtain from ultrasound. Then both the kidney status of the upper tracts are assessed, whether any stone is there, that is seen. All these things we get from ultrasound. After this, we The treatment options are myriad of treatment options available for BPH. Uh, we first then start the patient on lifestyle or conservative measures if the symptoms are very mild or they are not bothersome at all. So lifestyle measures, what are the lifestyle conservative measures done in BPH? First is we ask the patient to cut down his coffee intake or alcohol intake because these are the things which are irritants to bladder. Next is we ask the patient to control his water intake. He shouldn't drink much, he shouldn't drink less as well, because both are important. So we ask the patient to control his water intake, reduce the water intake after evening hours if nocturia, or he has to go at multiple times at night. So in nocturia patient, we ask the patients to reduce his water intake after the evening hours. We ask them to be more active, like perform some exercise or leave his usual sedentary habits. Then these are the usual conservative measures which help in patients with mild symptoms or no symptoms at all. They help them. Uh, then is the role of medical treatment. The role of medical treatment in enlarged prostate, there are a lot of medicines available. First of all, we must know what are the patients who are suitable for medical treatment. Mild to moderate patients having mild to moderate symptoms, they are usually the candidates. Uh, we must also know the sexual activity of the patient, whether he is sexually active or not active before starting the medical treatment. So the group of drugs available are, the most common is the alpha blockers. There are a lot of alpha blockers available, like tamsulosin, silodosin, alfuzosin, terazosin. Multiple are available, but the most commonly used are these three called alfuzosin, tamsulosin, or silodosin. Silodosin being the most newer alpha blocker available. So what are the effects of these medicines? The effects of the medicines alpha blocker is they basically relax the prostatic smooth muscles and the muscles around the bladder neck. This leads to enhanced flow of urine, and the person's frequency usually reduces, his symptoms gradually resolves. So after this is we start the patient on these medicines. The patient should know what are the advantages, pros of taking this medicine, what are the side effects of these medicine. So usually the pros are his Qmax or the maximum flow improves, his symptom resolution or the IPSS score resolution appears. Next is the patient says after a few weeks that he starts feeling better after taking these medicines. Then, what are the side effects of these medicines? What is the difference? Which patient should have tamsulosin, which patient should have silodosin or alfuzosin is based on the age of the patient, the sexual profile of the patient, and the side effects which these medicines are going to give the patient. So, usual side effects of these medicines are it can lead to orthostatic hypotension sometimes in 5% of the patient. Dizziness, few patients can experience dizziness if they get up early at night or suddenly. Then it might cause retrograde ejaculation. Retrograde ejaculation is fairly common in the patients taking prostate medicines. By retrograde ejaculation is the semen doesn't come out, it comes out in urine. So these are the usual side effects. In few patients, earlier tamsulosin used to cause intraoperative floppy iris syndrome called IFSIS, intraoperative floppy iris symptoms, but which is not usually seen with silodosin, the newer molecules. So if the patient comes to us, he's a young patient having mild symptoms of prostate. For these patients, we usually start with alfu or alfuzosin because the size of prostate is less and these symptoms are very mild and he wants to preserve his fertility, as alfuzosin causes less of retrograde ejaculation and less of disturbance in the sexual life. So alfu is preferable for young patients. Tamsulosin and silodosin on the other side are preferred for people more than 60 years of age or having moderate symptoms, moderate to severe symptoms, and these medicines have tremendous results, leading to good flow of urine. The nocturia episode reduces. The nocturia episode reduces, the urgency and the frequency, they also reduce once the patient starts taking medicine. Next up, what are the other drugs available for BPH? The other drugs available are alpha reductase inhibitors or phosphodiesterase inhibitors. So what are these alpha reductase inhibitors? ARIs are usually two types of ARIs. One is dutasteride and finasteride. Now, dutasteride, it acts both on both the enzymes, 5-alpha reductase enzymes, and finasteride acts only on one type of enzyme. So, dutasteride is a preferred drug nowadays. What it causes is, it causes shrinkage of the size of prostate by reducing the amount of testosterone available. So, as we know, prostate needs testosterone for its enlargement. It increases in size if intratesticular DHT or testosterone is high. So, these drugs, they basically reduce the amount of testosterone available. What are the side effects of these drugs and which drugs are to be preferred? In alpha reductase inhibitors, the preferred choice is dutasteride. It reduces the size of prostate, causes shrinkage of prostate. But on the other hand, since it reduces the amount of testosterone available, it causes some erection problems, especially in young people, and definitely ejaculatory problems happen. Sometimes, for prolonged usage, it might lead to gynecomastia because of increased estrogen. Next up, sometimes we use 5-alpha, after 5-alpha reductase, we sometimes use PDE5 inhibitors like tadalafil, 5 milligram of tadalafil. It leads to reduced symptoms of prostatism, but these are again usually not given in combination with the preferred drugs, which is tamsulosin or silodosin. So once we start the medicine, what are the effects? Effect is very good in 50 to 60% of the patients. But many patients, their symptoms progress in spite of taking medicines. They still continue to have increased symptoms or increased incidence of urine infections or stone formation. These are the patients who have to be dealt with surgery. So what are the next options, treatment options available for enlarged prostate? The options available are, earlier enlargement of prostate was dealt with surgical method like open surgery, but nowadays the role of open surgery is extremely limited in enlarged prostate. It is very restricted to only patients with very large prostate, even though those are also dealt with laser surgery. So the gold standard treatment of surgery of prostate is TURP. TURP, the meaning is transurethral resection of prostate. TURP is age old. It is now in practice since past 60 to 70 years. TURP earlier was done using monopolar cautery. Nowadays we are doing it with bipolar cautery. So what we do is, in TURP, we go through the natural passage only through the penis. There is no cut involved, no stitches involved. We go through the natural process only, and we cause resection of the path of prostate. This enlarged prostate, which is blocking the urethra, that part is cleared through resection, and the chips are removed. So what it causes is it leads to dilatation. The prostate fossa increases in size, which leads to increased flow of urine. So since the prostate enlargement impinges upon the urethra, causing the bladder to act more and more. So the bladder muscles gets thickened. But beyond certain point, the bladder musculature cannot thicken, it fails. The bladder muscles are called detrusor. It usually fails after some time, leading to leakage of urine. So with this surgery, there is an enhanced flow of urine. जो पेशाब रुक रुक के आ रहा था, जो बहुत धीमे धीमे आ रहा था, वो फ्लो बहुत अच्छा हो जाता है. The beneficial amount is nearly 200% improvement in the flow of urine. The leakage of urine also reduces the urgency, and all the symptoms usually resolve. So the patient gets admitted on the day of surgery and undergoes the surgery, is discharged on the very next day with catheter, and the catheter is usually removed after 3 days. That is the usual procedure in monopolar TURP. But now the recent advents, we are using bipolar TURP. Bipolar, having two loops, produces the plasma current in and around the tissue, so there is no spread of current, and we can deal with very large prostate by using bipolar cautery. So otherwise the procedure is the same. Once we are using bipolar cautery, we can use it with normal saline as well, because that was a limitation in monopolar TURP. We could not use normal saline. It was used in water or glycine, leading to sometimes water intoxication or over distension. And an entity called TUR syndrome used to develop in those patients because of over dilution of the plasma, which we don't see with bipolar cautery. Bipolar cautery is the preferred method which we follow nowadays if we have to do TURP. There is a reduced blood loss in bipolar for TURP, and we can deal even with the anticoagulant patients. Like we know, BPH happens in patients more than 60 years of age. So we can deal with bipolar cautery these patients, because these patients are usually on other medications as well, ecosprin and so many anticoagulants, which cause the blood to be very thin. So we can deal these patients with bipolar cautery. Next up is again with the latest advancements which are available for treatment of BPH is laser surgery. What is exactly laser surgery? Laser can be used in two forms in prostate. One is laser ablation and other is enucleation. So ablation is which we use is photoselective vaporization of prostate. Here the prostatic tissue is burned using laser. It is vaporized, and the size of prostate reduces. So vaporization of prostate is done for smaller prostate, less than 80 grams. But one side effect of this photoselective vaporization is there's a high amount of irritative LUTs or dysuria after the procedure, and hematuria sometimes. But the newer method which we follow is enucleation of prostate. So we have a state-of-art thulium laser available with us. Thulium is the latest laser, 60-watt laser with us. We cause enucleation of the prostate. We remove the prostate from above the capsule, and after enucleation, we push the lobes of the prostate inside the bladder, and then using a modulator, we remove the tissue. So we have tissue available for biopsy as well. We always send the biopsy specimen to rule out malignancy once we performing the enucleation of prostate. Now, the advantage of using laser enucleation of prostate is very large prostate. Bade se bada prostate we can remove using laser. We can use it in patients who are cardiac patients, who are high risk patients, who have risk factors for bleeding. So for those patients, laser prostate surgery is very beneficial. There are patients who have very low ejection fraction, who are cardiac patients, because most of our BPH patients are geriatric, they are taking some or the other cardiac medicine. So in them, laser prostate is very helpful. The Qmax or the flow of urine improves by around 200% in these patients. So laser is a new method of managing enlarged prostate if we have to manage it surgically. After laser prostate, the patient goes home the very next day and the catheter is removed after 2 days. He voids well and then he comes to follow up after a week. What are the other minimal invasive treatment available for enlarged prostate? The other treatment available are Urolift, the Rhizome technique, and prostatic artery embolization. So what I'll go in briefly and tell you about these small newer advents available for treatment of BPH. Urolift. Basically, Urolift or Rhizome or prostatic artery embolization is done in patients who are not fit for surgery, who have enlarged prostate, who have severe bothersome prostate, and they are not fit for surgery because of their cardiac comorbidities. So in these patients, the outpatient procedure followed is either Urolift, Rhizome, or prostatic artery embolization. In Urolift, we have small implantable nitinol devices which are injected around the prostate and up to the capsule. So what the Urolift does is it binds to the prostatic tissue and the capsule and dilates this channel, leading to enhanced flow of urine. It is done in outpatient procedure, 5 to 10 minutes, and patient is discharged in the evening. Now, which are the patients who are suitable for Urolift? Only small prostate, no enlargement of the median lobe. As we know, the prostate has two lobes, median lobe and lateral lobe. So median lobe is single lobe and lateral lobes are two, right or left lobe. So Urolift is used only in patients who have enlarged lateral lobes. If median lobe is there, you cannot use Urolift. Then the Rhizome technique. Rhizome technique is we use water vapor which are condensed, and using this water vapors, steamed water vapors, the prostatic tissue is lysed or necrosed and it is removed then. So it is again an office procedure and even can be used in patients with enlarged median or lateral lobe. Next up is prostatic artery embolization. It is again an interventional radiology procedure in which dyes are injected and super selective embolization of the prostatic artery is done. Once the arteries are embolized or coiled, the size of the prostate gradually reduces. These patients are discharged on catheter and the catheter is removed after 2 to 3 days and the size of prostate gradually reduces with time. So prostatic artery embolization is again done for patients who are having some cardiac comorbidity because of which they are not fit to undergo TURP or laser surgery. So these are other treatment options which were available in patients with BPH. Now, next up, what the patient want to know, what are the complications associated with the surgeries? The complications are, these are very safe procedures and they are life-changing because you can see if a patient comes with retention of urine, once you perform this procedure, he is catheter-free. But the surgeries are associated with few side effects like dysuria, burning in urine, which can persist till the prostatic fossa is healed. Sometimes recurrent retention might appear if the patient applies too much of force after the surgery during passing of stool, or sometimes the bleeding might persist for a few days. Only one major drawback or the major complication is leakage of urine. Because of the damage to the sphincters. These are very rare, it happens in only less than 1% of the patient, and it can lead to leakage of urine. So if there is a mild damage, the sphincters usually recover, but if there is a severe damage, it might lead to gross incontinence, which usually we haven't seen much. Next up is what are the results of these surgeries or the medicines which we give for prostate. The benefits are the tremendous benefit of taking medicines as well as surgery if it suits you, like the flow of urine improves, the symptoms of LUTs they reduce, the patient is happy, he is voiding well. So these are the improvement. But surgery leads to tremendous improvement in the flow of urine, nearly 200%, and reduction in his LUT symptoms by 6 to 7 point score. So these are the treatment options of BPH and various treatment which is available. Next up, I would like to take few questions if there are any. Yes. So next, Rohit is asking how quickly will symptoms get worse and is surgery only an option, doctor? Symptoms, once you start the medicine symptoms, Rohit, we have to assess the patients. Usually once we start medicine, we ask the patient to follow up after 3 to 4 weeks, and then we assess his symptoms. If patient are doing well with the medicines, we continue the medicines, or if not, if the symptoms are getting worse with time, he's having recurrent UTI or hematuria, bleeding in urine, or enlarged prostate leading to derangement in his kidney function or bladder failure, then we have to, then the patient, if there is no option, then he has to undergo surgery. Mr. T.N. Goel is asking, what are the 5 early signs of prostate cancer? Okay, so the early signs, warning signs of prostate cancer, Mr. Goel, they are similar to the symptoms of prostate, like nocturia or getting up more at night, dysuria, burning in urine, or hematuria. Hematuria is seen in 10 to 20% of the prostate cancer. They cause bleeding in urine, or usually most of the time it is prostate cancer is diagnosed on serum total PSA, increase in serum total PSA, or by digital rectal examination. Sometimes if they are progressive, then BPH can lead to reduction in diet, appetite, or enlarged lymph nodes around the groin. These are the last signs of prostate. So the early signs are similar to BPH. Hence, every BPH patient should be examined by a urologist to rule out prostate cancer. Next is, what are the chances that the cancer has spread beyond my prostate? The chances of the cancer spreading, it depends upon the duration and the type. If it is severe type of prostate cancer, it can definitely be a progress. So usually the stages to the progression, every cancer has stages, hence prostate cancer also has stages. Earlier, they are confined to one or the other lobe, only confined to the prostate. Once they cross the capsule, they might spread outside the capsule, leading to enlarged lymph nodes, and it can spread even to the bone. Bones are preferred site for prostate cancer. How do I know if my prostate is okay? Devendra is asking. So Devendra, first of all, if your you must visit a urologist. He will examine you and check you, and you have to undergo ultrasound and digital rectal examination and PSA testing, and then only will come to know if your prostate is okay or not. Is stage 4 cancer curable? See, the topic was BPH, but most of the questions are for prostate cancer. Yes, stage 4 cancer. Also, one thing about prostate cancer is it has a lot of treatment options available, Ashish. So in stage 4 prostate cancer, it is never a stage 4 prostate cancer is curable, but definitely treatable. there's a difference between cure and treatment. So it is definitely treatable. Treatment options are many treatment options available, from ranging from orchidectomy to hormonal therapy to chemotherapy or radiotherapy. So these are called palliative measures which we follow in stage 4 prostate cancer, and definitely the growth of the prostate cancer is reduced if we take this treatment. Once we do orchidectomy or hormonal therapy, the newer hormonal therapy are very effective in stage 4 cancer. Next question from Shubez: is prostate cancer genetic? So yes, there is a role for genetic testing in prostate cancer, and prostate cancer, one of the risk factor is genetic. Family history, a strong family history, if it's there, it is likely a cause for prostate cancer. How quickly do I need to decide on treatment? If you are having symptoms which I mentioned, like frequency, urgency, nocturia, or hesitancy in urine, or poor flow of urine, then you definitely need to undergo test, and then treatment has to be started. Once your symptoms are mild or moderate or severe, based on that we grade you and then we start treatment. How can I improve my BPH symptoms, Nagendra? So Nagendra, you can improve your BPH symptoms if they are very mild or non-bothersome. Few lifestyle measures which I mentioned, like cutting down your caffeine intake or alcohol intake, controlling your liquid intake, the water you consume, and cutting irritants from your diet, having a good lifestyle in which you are exercising. Those are the remedies how you can improve your BPH symptoms. What are the home remedies to reduce prostate? Okay, so these are home remedies which Nagendra is asking. They are called phytotherapy. Earlier they were used, still they are used, like Seronoa, Repens, few homeopathic drugs. These are few home remedies to reduce prostate, but they, with recent studies, they are not found to be very helpful. Next question, I cannot take every question. What is the 5-second exercise to shrink the prostate? No exercise will help you to shrink the prostate. It is a gland located in the pelvis. But what exercise, with exercise you mean you should do Kegels exercises. They will help you in controlling your urgency symptoms, in having a better continence, because if the prostate is very much enlarged in size, it can lead to incontinence of urine. These are the questions. How long can a person live with prostate cancer? How long a person can live with prostate cancer, that depends upon the grade and the stage of cancer. But usually, once we diagnose the prostate cancer, it's a slow growing cancer, so it gives us a lot of time after diagnosis also. Even if after metastasis, it gives us around 5 years of time to live with prostate cancer. I think time is up. We have done, I think, as most of the queries have been answered. So thank you, and people who have joined me from Bangladesh, hello to you. খুব ভালো লাগছে আপনার সঙ্গে কথা করে. See you soon. Bye.